At MidAmerican Energy, we're one company serving 1.6 million people who all need energy that's available 24/7. That's why we work 24/7. That's why we make investments in our systems that make us more resilient to extreme weather. That's why we generate power from all available resources to cover the variables in supply and demand. And that's why when the power is knocked out, we work around the clock to restore power to you. MidAmerican Energy, obsessively, relentlessly at your service.
I'm Jared Strong. I'm a reporter for the Gazette. Thanks for joining us for our annual Iowa Ideas virtual conference. For this session, I want to thank MidAmerican Energy, ITC Midwest, and the Driftless Water Defenders for sponsoring us. If you have questions at any point, just toss them in the chat and we'll try to get to them. So we are here to talk about lead in our drinking water, a dangerous issue that has that affects children the most. If by chance you get shot by a lead bullet, you aren't likely to be poisoned, but if you ingest it, the neurotoxin can cause significant damage to your brain. And that is why it's so especially concerning for children. This is fortuitous timing as well to have this discussion because the Environmental Protection Agency just released its revised lead and copper rule with a goal of eliminating all lead drinking water pipes in public water systems in what will be about 13 years is the goal. Joining us for this discussion are two of the most dapper men in environmental research and advocacy. We have Dave Swertney, a University of Iowa professor and researcher who leads the Center for Health Effects of Environmental Contamination. He has all kinds of other titles too, but we'd waste a half hour probably trying to get through them. So we'll leave it at that.
That works.
Also, we have Michael Schmidt, an attorney for the Iowa Environmental Council, which, if you're not familiar, is basically the gold standard for environmental advocacy in Iowa. Both of these guys I could call to comment for virtually any story I'm writing about the environment, and I always learn something. So let's get to it. Dave, I'm giving you the maybe instrumental task of giving us the lead water pipes 101. What's the background? Why was it used? When did we figure out there was a problem? And how bad is that problem right now?
Yeah, thanks, Jared, for having me. Thanks to the sponsors. Thanks for Mike for joining me on the panel, really. And all those of you in attendance, thanks for being here to listen to us talk on this important topic. So we've used lead in plumbing for like literally centuries, right? I mean, there's thoughts that lead was contributing to the downfall of the Roman Empire because they used lead in their plumbing as how they brought water into the city. And people have always liked using lead because it's like a soft and what we call a malleable metal. It's something that you can easily shape. And so when you think about how you need to, say, run piping, maybe bend it, maybe work it into existing or new infrastructure, just had a lot of favorable properties, and it also was low cost and readily abundant, right? And so when you're trying to build something and it's easy to work with and doesn't cost a ton, it really found its way into a lot of plumbing materials that now, unfortunately, are still in the ground. We banned lead. I want to talk a little bit nuanced about this. Like, we banned lead plumbing in 1986. This was not at the same time. This was sort of in response to the realization that leaded gasoline was a problem, leaded paint was a problem. And so there's some really important figures from, say, like the CDC that shows how policy to start phasing out lead in different products that consumers used really did transition to leading to lower blood lead levels. And so you saw that, turning off the source really did lead to improvements. But an important distinction here is we got to lead in water a little bit later than we got to those other things. And so the risk factors, say, for infrastructure are a little bit different for lead in water than it is, like, say, lead paint in homes, where the phase out for lead paint was in the early 70s or mid 70s, and it wasn't until 86 where we got to water. The important caveat I'll make is, what we have as lead-free plumbing today is still allowed by law to have a certain weight percent. I think it's 0.2 weight percent of lead in it. So that's always one of the more crazy and sort of frustrating stats is, even today, with all the issues we know, plumbing material that comes into contact with water is still allowed to have a small amount of lead. And we can kind of think like why that is. It's just why we can't get over this hump. But probably the bigger and more urgent and pressing issue is we still have a lot of this infrastructure in the ground. And so across the US, we have a lot of older housing stock, particularly here in Iowa as well, that have lead service lines that we have to remove. And it's a non-trivial number. I didn't do my due diligence ahead of this, and there was a recent needs assessment, but we're talking on the order of like tens of hundreds of thousands in most states of lead service lines that need to get removed. And so it's not going to be a small effort to eliminate drinking water as a risk. And I guess the last thing you asked was, where does lead in drinking water fit in? And we always talk about, as you mentioned, that infants and young children are most vulnerable. I think, a big argument to get lead out of water is for water that's used to make formula and bottle fed to infants. There's been some studies that have shown that some of the greatest proportions of lead exposure through water come to infants that are having their formula prepared with lead contaminated water, and then it can be almost up to a third or a third of the lead exposure when you think of other sources and like soil and dust and paint. So we want to do this because we know that it's that combination of a vulnerable group that's at highest risk of exposure, which is like the worst case scenario, right? When you have your most vulnerable also have the highest propensity to potentially get exposed through water.
Well done with that rundown. Michael, I'll let you handle sort of like the the policy, the regulation side of things. What are we doing at the federal level to identify where all these pipes are? And what does this new rule that was released this week say about how we're going to take care of it?
Yeah, well, I'll start by also thanking you for having me on this panel, and thanks to the sponsors. And it's great to be on a panel with Dave. The rule this week is the culmination of many years of legislative and regulatory efforts to address lead pipes. As Dave mentioned, the Safe Drinking Water Act was amended in 1986 to prohibit lead pipes. So that's kind of when we started this process of addressing them. And as Dave said, it's probably later than we should have, because there were cities like Chicago that were installing lead pipes up until that date. So now Chicago has hundreds of thousands of lead pipes just in the city of Chicago. EPA has adopted a series of rules to implement the prohibition and to start moving toward getting rid of them. They adopted lead and copper rule in 1991, and then a few years ago, there was a lead and copper rule revision. And so that required an inventory of lead service lines, which interestingly is due next week. So the new rule was adopted in time to come out before that deadline, intentionally, but the deadline is still in place. All of the public water supplies need to provide an inventory of lead service lines by next week. And those inventories are going to Iowa DNR. So DNR will get something like 1,000 inventories from different places in Iowa, estimating or calculating how many lead service lines and other lines requiring replacement are in each water system. I think a number of people thought the lead and copper rule revisions from several years ago didn't really go far enough, because they didn't those revisions didn't require replacement. They didn't lower the action level for public water suppliers to start reducing lead. So the Biden administration came out with the lead and copper rule improvements, and that's what came out this week. So it does do some of those things that folks thought were missing in the last rule. So it requires replacement of lead service lines within 10 years of the compliance date, and that compliance date is a few years out. So that's how you get this 10-year timeline, but it doesn't start yet. So it ends up being longer than 10 years until we would actually have all of the lead service lines out.
Sorry, go ahead.
It keeps the inventory requirement, like I mentioned, and it changes a couple of other things. The action level for lead in water is going down from 15 to 10 micrograms per liter. So at that action level, if the water supplier finds lead at that level, then it has to change practices or take some action to address the lead in the drinking water. So it's kind of a trigger point for taking some action because there's not a safe level of lead, especially like Dave said, for those vulnerable infants and vulnerable populations. The rule also changes the sampling requirements for taps. So there are different tiers of water suppliers, and so depending on that tier, you might have to sample the first liter of water and the 5th liter of water. And so it changes those sampling requirements. Dave might be more of an expert on that because I am not a sampling expert. So those are some of the highlights that this new rule changes. It does still allow waivers for schools and childcare centers, which some groups like IEC are concerned about. And it allows those facilities to use old samples from before the rule was issued, which means they might not have the most recent data on the risks to those folks drinking water. And the rule itself does not address how to pay for all this, which is another bigger issue that we have to deal with.
Have you read all of it? How many hundreds of pages is it?
It is 890 pages. So no, it came out on Tuesday. I've looked through chunks of it, but not all 890 pages.
Okay.
Come on, Mike. Come on. Pick it up.
I look forward to the book report after you complete.
I'll get that to you next week.
Exactly. I think AI can help with that. I'm kidding.
Good point. Yeah. So what you guys have said, no amount of lead is safe. The action level has been lowered. Dave, should the number be 0, or is that an infeasible number to put out there?
Yeah, that's an excellent question. I think it's important. I'm glad Mike talked about the changes that are coming. Those action levels have never been health-based. I think it's really important that we acknowledge that when EPA sets a standard, they usually start by setting a public health goal. And the goal is like the blue sky scenario of if things were perfect, what would we want? And for lead, that's 0. It's an acknowledgement that there is no safe exposure. These action levels that they set at 15, initially, and now revising it down to 10, are really just, the best I've heard it described is by my colleague Andy Welton at Purdue. He says it's essentially like a check engine light on your car. If you see that, it's supposed to, as a water provider, as a water utility, you're supposed to, it's a sign that your distribution system's got issues. It's corroding, and that you shouldn't have metals there that are. And I think that's the way to think about it. It is no way saying that 10 is a safe level to have in drinking water, particularly for vulnerable populations. And so we have to keep kind of banging that drum. At the same time, 0 is never a feasible option in any water treatment scenario because one, there's just always that annoyance of there's just limits to what we can actually measure. And so we'd never measure 0. We'd just measure below what we could actually see. But the other issue is just really hard. Some folks have been saying that, the American Academy of Pediatrics has advocated for 1 part per billion or 1 microgram per liter is what we should shoot for. And absolutely, if we can do that and we can think about creative ways to do that don't break the bank, we should aspire for that. But that's very challenging. So I think 10's a step in the right direction. I know many folks wanted something lower. But I think Mike brought up a really good point on cost. And lately, it's a bit of a slog to get the federal government to sort of put the amount of money towards something that's as big as this issue. And that's something I think we'll see play out over the decade as people try to replace lead service lines is where's the money come from? And as well as a few other things, but I think we'll probably go on to talk about that and some of the other challenges that come along with this rule.
Yeah, that is a nice setup for how effective do you think the new regulations might be in getting us toward, removing all these lead service lines. You've got money that's going to be an issue, and then you've got, buy-in from homeowners, right?
So, I mean, and I can jump in here first, and then Mike, I definitely want to hear what you have to say. But, Mike, there's a couple of ways I'd answer that. Like one, Mike talked about the tier system for sampling. And one challenge is that there are tiers that are like for different types of residences. And but one of the issues is there's a lot of homes, like we've been working with the city of Iowa City, to get categorized in a tier known as lead service line unknown, where there's probably compelling evidence there's a lead service line, but you don't have definitive proof. And so one of the challenges is how communities, as they finalize their inventory and then act on their inventory, address this issue of these lead service line unknowns, where there's not a lot of easy ways to diagnose without a lot of work. How you actually is a lead line actually there? We have indicators like when it was installed, the size of the tap into the main line, because lead was a different lead pipe ended up being different sizes than some of the other pipes that were used. But again, if you don't know definitively, it gets categorized in a way that there's going to have to be more due diligence. That'll be difficult. The other big issue is that the timeline is really aggressive. I know people don't like to hear that, and 10 years sounds really long, but the good example that has been in the register a while back is Des Moines has 20,000 lead service lines. And so just do the math on that. At 20,000 lead service lines, 10 years, you're replacing 2,000 service lines, which is, that's like 3 a day, right? Or something. Just quickly go through it and you start asking the questions, do we have the people to do it? And I know the administration is saying this should create jobs because we need people with the skilled labor to go and do that. But that's like, you're on the clock. You got to be, are you doing your 2,000 a year? And then the other challenge is the money. I mean, Ted Corrigan at the Waterworks will tell you it's about $10,000 on the low end to replace one of these lines. So doing the math on 20,000 lead service lines in Des Moines, 2,000 a year over these 10 years at that price tag, it's a commitment. And the clock starts now. And then finally, I mean, if you've heard me speak before on all of our water issues, I always say Des Moines is like the best case scenario in Iowa because they are a big city with a tax base and a revenue base and, more folks moving there than not. And so if Des Moines is going to have these monumental hurdles, like what about some of the other smaller communities in Iowa that are losing their population, might be losing ratepayers? This is all stuff we're going to have to try to figure out.
Yeah, I think I can add a little bit to that. Des Moines did a pilot project. Des Moines Waterworks did a pilot project trying to replace 100 lead service lines for free to the homeowners, just to see how well it works and get a better sense of the cost estimates. And the first problem they ran into was that people just wouldn't sign up. They didn't believe it was real. They didn't want their lives disrupted by having their water line replaced. I don't know exactly what it was, but they couldn't get people to sign up. So they expanded beyond the initial neighborhood that they were targeting, thinking at first that they could just go right down the line and replace everybody's service lines and it would be more efficient. But then those folks didn't sign up. So they expanded to another neighborhood and ended up, even with that, with fewer than 100 people participating. So that communication and outreach and cooperation is going to make things very difficult. Just getting kind of the logistics and outreach done in time, like Dave said, is a huge hurdle that I don't think anybody has figured out how to overcome yet. And then on the funding side, the bipartisan infrastructure law has provided quite a bit of funding. Iowa has gotten, I think DNR has reported $162 million, which is a big number, but it's not close to what we need. It is maybe an order of magnitude less than what we need, or slightly more than that. I saw an estimate that we have something like 100,000 lead service lines in the state, and it's $10,000 for each of those. That's $1 billion right there. And so the 160 million that we have so far is a small fraction of that. And the federal money that we've been getting through the bipartisan infrastructure law is partly forgivable. So there can be forgivable loans with 49% of the loan being forgiven if it's in a disadvantaged community. But we don't have a clear answer for the other 51% that is not being forgiven. And so that means we need either water rates to go up or state funding or individual homeowners paying half the cost for this $1 billion replacement. And that gets even more complicated when you have a mix of ownership structures where the homeowner sometimes owns from the curb, sometimes owns just half the line. And so it's different for every utility exactly how much of the private lead service line is getting replaced. And the federal money only goes for a full replacement, not a partial replacement. So if the homeowner owns half the line, the federal money can't pay for just paying for and replacing the city-owned half. It has to cover the whole thing, a whole replacement, which means people's lives will be even more disrupted. You might have more objections if the homeowner portion, is not what the homeowner wants to have replaced.
And I'll add to that real quickly. Mike touched on some really important pieces that the ownership one is a tricky one because we've talked to utilities. I want to say, and I'll go back and double check, but I've talked to both Iowa City and Des Moines, and both have told us that they have models, and they say it's more common in Iowa where all the ownership is private, all the way out to the main. It's the homeowner's responsibility, which is an extra large challenge. And the final point is, there have been estimates by like the American Water Works Association that says this is like a 40 to $60 billion problem. So let's just say 50 billion nationwide. And I think the bills that got passed, like the infrastructure law, ended up with 15 billion devoted to this. And there was a lot of, well, we need states to use ARPA money. We need states to use other sources. I mean, I have been sort of really strongly advocating that we keep paying attention, right? Like we see headlines that Biden is going to remove lead from every drinking water source, and we didn't get all the money we needed. And then you're still relying on each of these states and local level governments to actually use it effectively. And so I'm really concerned about, our short attention span on these issues of people just thinking like, oh, like I've seen a headline, we solved it. No. Like the work is just beginning, and we know that we've got more work to do because unfortunately, it wasn't enough. And I'm not blaming the administration because we understand the politics of how money is dispersed, but I do caution some of the rhetoric that this is going to be magically solved with just what's been done already, because there's more work to be done.
Yeah, well, I think, the buy-in from homeowners is going to be a big thing. And Mike, you totally stole my thunder on the Des Moines Waterworks pilot project. I think it was 87 people that they got to sign up, agreeing to pay for the entire thing. And they went door to door knocking. They used mailers. They put up yard signs. They hung posters. I mean, it seemed like a pretty big and comprehensive outreach program. And still, they had to contact like 300 people before they got those 87 to say yes. Mike, real quick, a question for you from the chat. Can investor-owned water utilities get public funding for this?
I have not read anything about that. I have not looked that up in the 890-page rule yet. So I am not sure. But I could, if folks are interested in that, I could look into it and get back to folks later, or they can reach out to me.
Cool. We do have another question from the chat, and this pairs up nicely with what I was just about to ask. So some cities, or I don't know, Dave, maybe you know how many, if this is a pretty prevalent practice, but adding minerals to the water to sort of create that barrier on the inside of pipes to keep lead from leaching into drinking water. Is that effective? And the question from the chat was, please discuss studies about lead exposure from service lines and how basically these types of mineral coatings can improve the situation.
Yeah, so that's actually just the common practice of what we know, what is known as corrosion control. And certain sizes of water systems, particularly larger systems, are like required to use corrosion control, and we actually add mineral like phosphate, so polyphosphate. And what this does is we know from like the chemistry side of things that phosphate likes to stick to metals and then form things that don't stay dissolved in water, but form like what we call a precipitate or a scale. And so we intentionally add things like polyphosphate to water. You can also do this simply by raising the pH or the basicity of your water. And that forms a protective scaling or coating on the inside of the pipes that doesn't let the metal from underneath leach out. And this works. It's a required what we call a treatment technique when it comes to the Safe Drinking Water Act. The other part of we know what happens when it doesn't work, and so Flint is a sort of a worst case scenario of this, where they basically changed their water source where it was more corrosive, meaning it's more likely to etch those, like eat away at those protective scales, and then compounding on that in a cost saving measure, they stopped adding their corrosion control agent. And so they ended up basically with like a worst case scenario of no longer having that protection through the scaling and changing the conditions of the water where it actually destabilized it. And that's where you got the lead release that you did as they switched their water source. So it is it's funny, it works, it absolutely does. You will hear some folks that are concerned about it, particularly folks here in Iowa might be wondering like, hey, aren't we trying to keep phosphate out of our water? And that is a consequence, that if more communities go to polyphosphate addition for corrosion control, like a smaller system, you will see, like, the same water that we drink is the same water we use to fill our toilets, and then we'll flush it and it'll work its way to a wastewater treatment plant. And it's just going to be a background nutrient level that we have to think about. But in the environmental engineering, chemistry, water treatment biz, all it is trade-offs, right? And so it's just finding the right ones for the right groups and the right communities. So hopefully that's a sufficient answer. It works. A lot of places do it, and it's good that they do, because it offers good protection. Des Moines uses corrosion control, and it's why they stand by their record of never having an LCR violation and really having reasonably low 90th percentile samples in terms of like what they measure in their sampling sites.
And then going a bit further from that question, again, something I was just about to ask, what are the other sources of lead contamination in our water? I mean, we're doing all this, we're going to do all this work to remove lead pipes. Are those the primary threat to us, or, where are the other sources of contamination?
I will say that absolutely a risk factor for whether or not you have lead in your water is if you have a lead service line. If you have a lead service line, it does not mean that you have lead in your water, because there might be effective corrosion control that prevents it from leaching out. Your water might be what may not, what we say, destabilize it and cause that corrosion. However, another concern with our fixation on the lead service lines is that there's lead and other plumbing inside the home, and so that's another part of like the rhetoric of how we talk about lead in drinking water is we could remove every lead service line, and we would still have consumers getting lead in water because of goosenecks in their homes, fixtures, like some brass has lead components. And we see that a lot. We're working on methods at my center, the Center for Health Effects of Environmental Contamination, to sort of try to distinguish from water and analyzing a water sample if the lead is coming from the service line or if it's coming from elsewhere on the property. And that's actually an interesting study we're doing, because metals, you look for other metals and you see lead associate with different metals if it's, say, coming from a brass fixture than it does if it's coming from a service line. So we're trying to develop cheap diagnostics, but we also need it for risk assessment, so people know if they have lead in their fixtures at home. The good news about lead in fixtures in homes is it's usually a cheaper and easier fix, right? If I've used a bad solder, because we didn't phase out lead in solder until the late 70s, we can just replace that solder, and plumbers will do that for you, and it won't break your bank at like to the tune of $10,000, like removing a lead service line. But people have to be aware and understand that risk is still there. And then I'll also just say, like, we can't ignore the fact that when you remove lead service lines, we have a lot of things like shared housing, like apartments. If you're a renter, it's up to landlords. And so the other piece to this puzzle is making sure that we're communicating to all residents of all types of homes and occupants, in terms of if you're renting, if you're leasing, if you have a landlord, like there's things we can probably do to be more proactive in protecting renters and folks that don't own homes. that may not know about these issues if they don't have a proactive landlord. That probably has to happen at the city or county level, where we could put in code that would require testing in those instances. And we might need to do more of that, because those are a bit of black boxes in regards to where the lead could be coming from.
And one related thing, Dave talked about the lead being destabilized. And so one of the reasons that the testing approach is to take the first and the fifth liter of water is that the water that's been sitting there for a long time can gradually accumulate lead if it is destabilizing the lead. And so flushing through the system means that the water after the first water of the day has not been sitting there, and it won't have the same levels of lead. So even if you have lead fixtures, having that water flowing so that it's not accumulating lead can reduce the amount that goes into your drinking water.
So as far as testing taps go, I want to say that the DNR is monitoring maybe 120 known contaminations right now. Do you guys have any idea on numbers on that? How are these contaminations identified? Like, what leads to it? Hey, I live near a town of 10,000 people. How does any one of them find out that, oh, I've got lead in my drinking water?
Mike, do you want to take this, or I'm happy to, but
Yeah, go for it, Dave.
so the lead and copper rule has always required what's known as 90th percentile sampling. And so this is a bit of a kind of a wonky statistical way in which they do water testing for lead and copper, but every water utility has, so there's several unique things about lead. One being that it's not present usually in source water, right? Like we use our rivers, our streams, and groundwater, and you're not finding lead in those unless there's been really aggressive industrial contamination. Where it comes from is after it leaves the water treatment plant and how it comes into the water through our distribution system, the pipes that deliver the water to your home. What's challenging about that is for the 90 some odd things that we regulate under the Safe Drinking Water Act, the compliance point, like where you measure to say the water meets the standard, is usually when it's leaving the water treatment plant. Like for nitrate, that the one Waterworks is measuring nitrate that leaves and goes into the distribution system to say, yes, it's below 10. But that's not how lead works. They actually find a required number of residences, of homeowners usually, that meet those tiers that we were talking about, and they give them bottles. And then they give them that Michael was talking about, stagnation, like you let the water sit and then you collect it after it flows. Like you instruct the homeowners to collect it. So it's like one of the few things that we don't actually test at the water plant. We test it in the home. And then what they'll do is, let's take the simplest case of if like a community, let's hypothetically finds 10 people to sample. What you do is you take your 10 results and then you stack them from lowest to highest. And then the ninth sample by statistics is what we call the ninth highest is your 90th percentile sample. And by the classic LCR, if that ninth sample, the 90th percentile of all your samples in your community is above 15 parts per billion, then that itself is historically, and it still is not a violation of the lead and copper rule. What it is it triggers the utility to do a bunch of things. You have to notify the residents. You have to maybe do corrosion control if you meet the requirements. And so it's actually the failure to do something in response to that action level exceedance. That's what we call that 90th percentile being above 15. If you fail to respond, then you get a violation. Things have improved. It used to be, you could envision a scenario where you would do those 10 samples and your 90th percentile sample would be below 15, but you might get that 10th sample being like 30 or 40 or something really unsafe. And historically, the EPA didn't require utilities to tell that homeowner, like, while we as a community didn't exceed the threshold, like, you're out of luck, your water's really high. It wasn't until after Flint and the passing of what was known as the WIN Act, Water Infrastructure for the Nation or something like that, that they put in that requirement. And it'll be a similar thing with this new action level, is they're going to take all their samples and look at the community as a whole. And if you're still sticking with me after that really like detailed discussion of how this goes, there is a challenge to this. And it's that the way we do the testing, there's two big limitations, if you ask me. One, it's always a very small number of residents in a service area. And so the question is always representativeness. The EPA says you have to pick homes that are probable of having a lead service line, may have galvanized with lead, before lead. but it's still like it's a small fraction of consumers usually. So that's a concern is, are you actually testing everybody? And then the last little bit is, when a group like the Des Moines Waterworks can't get neighborhoods to invest and do that buy-in on getting your line paid for, I'm fairly confident. I'll just leave it and say that this is like my speculation, but it is true. There are certain neighborhoods in a service area where folks don't trust the water suppliers, and like we know that, like say lead service lines and lead paint, that tends to correlate with traditional environmental justice descriptors like low income, community neighborhoods of color. And if we're not actually testing where we have the highest probability of finding it, that's something we're missing, right? So we really got to be careful about these blinders or these sort of black holes that we don't test enough. We may not be testing in the right places, but that's still okay by the letter of the law. Those are some of the challenges with how we do this. Sorry, that was a really long answer, but there's a lot of important things in there, if you ask me.
Oh, you're good. And we've been exclusively talking about lead pipes, but I just want to mention real quick, galvanized iron pipes fall into this too, right, Mike? Can you tell us under what circumstances those need to be replaced as well?
Yeah, so there's a category that's not directly lead lines, but galvanized requiring replacement. So if those were downstream essentially of lead lines, then they also require replacement under the new rule. And so there can be lead that was historically in place kind of upstream of one of these lines, but because it has been downstream of a lead line, it will still require replacement. And so that expands the universe where people who thought that they got a lead service line replaced years ago may still have to have some pieces of piping replaced going forward.
Well, it's my understanding too that galvanized iron doesn't last. It doesn't have a terribly great lifespan anyway, right? Can it get corroded and have other contaminants that get into the water?
Yeah, it can have its own other issues. Dave started out talking about how lead works really well and is malleable and things like that. And so not every piping system has all the same qualities while also not producing lead. So,
Yeah.
so it creates issues for folks.
Everything's a trade-off. Again, like I mentioned my colleague Andy Welton, who studies like water infrastructure and pipes and decontamination of homes, and we sort of will joke about, like, if you asked 10 people what's the right types of plumbing to have in and around the home, you get a variety of answers. Like everything comes with issues. Like PEX is a plastic that will absorb more of like your organic types of contaminants, and can actually promote bacterial growth better. Copper can still corrode, and we do worry about copper. It's not as toxic as lead, so we do lead at these 10 and 15 parts per billion or micrograms per liter. We worry about copper at 1.3 milligrams per liter, but it's still, we've had instances of really corrosive water hitting copper pipes and having unsafe levels of copper. It's not the same level of impact. Lead's a neurotoxin. Copper, if you've ever thought about how you sometimes add copper to like fresh water to kill things, it kind of does the same things in our gut. And so it'll just lead you to basically having diarrhea and a few other things, like if you or have a bad reaction to antibiotics and kill out all of your gut bacteria. So it's always trade-offs. But yes, galvanized is not a great one. I grew up in a house with galvanized plumbing, and I'm actually pretty excited because in the near future I'll finally get a chance to test what the lead content of that water is for the house I grew up in, and we'll see how smart I could have been.
We've got a question from the chat. Are there studies on whether lead service line removal is a cost-effective risk reduction? Would it be a better option to give people filtration devices, especially for high-risk people?
I don't know, Mike. I've got thoughts on this, but I don't know. I've always feel like I'm jumping in first. I'm happy to give you a first crack, and then I can add context.
Yeah. So in the EPA rule, EPA found, based on its economic analysis, that the rule requiring replacement of all these lead service lines has a 13-to-1 cost benefit or benefit to cost ratio. So the benefits are 13 times greater than the costs, and that's because of things like better development, and you end up not having to pay for some of the health costs associated with lead toxicity. So that means better development of children, fewer people born with low birth weight, reduced ADHD, reduced heart disease deaths, fewer IQ points lost. So you end up with a healthier population overall, which means, fewer health expenses and a more productive workforce. So the benefits EPA estimated are something like $13 to $25 billion a year, which is a very wide range because there's a lot of unknowns. But avoiding those costs is definitely good for everybody in society. I don't know if they looked at full replacement versus treatment. So Dave, I don't know if you want to talk about treatment options other than getting rid of your lead service line.
Yeah, so there's some, and I want to just one important stat to follow up on that we always share in talking about this is like there's been enough studies done, and as Mike was so nicely explaining, we kind of understand the health impacts of lead really clearly. Like you can tie lost IQ to lead exposure, and then you can tie lost IQ to earning potential and things like this. That cost to benefit ratio for lead interventions in the home, the American Academy of Pediatrics has found it's on par essentially with childhood vaccines, which I know is now sort of a controversial thing, but it's a big deal if we can get it out. On the treatment, the challenge with treatment, EPA is always a little bit wary on mandating what we call point of use water treatment devices, things that you would put at your tap. Mostly because, again, you're relying entirely on the consumer to use it correctly, install it correctly, maintain it. So a simple carbon filter will provide a ton of protection. And Jared, when you talk about getting to zero, that's probably about that, or under-counter RO is about as good as you can do if you really wanted to make sure you were minimizing your risk. Those do come with costs. The RO is pretty expensive. A lead filter is not, right? A carbon filter, like many of us have in our fridge, is not. I think one of the challenges that happened that sort of, and I think it'll get resolved, but it kind of shook the confidence of the point of use groups. There was after Flint, there was a lead and water crisis in Newark, New Jersey, and they distributed filters. And they were usually these pitcher filters, and they were actually finding lead, some forms of lead were breaking through. And so there was some of it's a combination of them just not being used and maintained. Some of it was that there's two types of lead that can be in water. Some of it's the dissolved forms of lead. So that's just like a lead atom kind of happily moving along with the water that we drink. And that's what we would say is dissolved. But the others, we know that lead can like stick to some of those scales, like particularly in galvanized pipes, and you can get little flakes of leaded material, actual particles coming off, and those small particles can break through some types of filters. So I think if you wanted to remove the risk to the greatest extent, you would get the source out. If you could rely on treatment, even though and it is more cost effective, it's 10,000 for service line, 1,000 for reverse osmosis, that gives you protection. So, I don't know if they did that sort of analysis, but I think you could go either way. But heck, you'll got places like Des Moines that feel like they do corrosion control so well that there's not much of a risk to their consumers regardless. And I think that's some of the frustration they might have run into. I don't know. I mean, you got to study that. But if you want to tout your record of safe water and that you've never had a lead issue, it's going to be really tough to convince people, that they should pay all this money to get a source out, right? So.
Yeah, so in the regulations we've been talking about target public water supplies. What about people like me? I live out in the country. I've got my own well. My house is about 10 years old, so we have plastic pipe everywhere. So I'm fairly certain that I don't have lead, but I mean, how much of a threat is that for people who have older homes and have their own well, and what do they do about it? Is it expensive to test your water for lead?
It doesn't have to be expensive to test your water for lead. The State Hygienics Lab does it pretty reasonably, and then we run our Get the Lead Out Iowa program out of my center, where we'll mail you a test kit we're sort of in a bit of a transition where we've usually done it. We will continue to do it for free for high risk groups. If you've got young children or you're an expectant mother, we do that testing for free. For others, we're going to start asking that folks help us pay for at least shipping. We mail you a box, you mail the bottles back. So for the cost of at least shipping, so we're just not losing money on that. We'll do the test for you at cost, at that cost. We know that there can be leaded components in wells. There are studies that have shown in available data through, say, the Grants Counties program that find levels of lead above 15 parts per billion that are on par with what you might find in the average, community water system. So if you got older wells, we certainly know there were leaded components that were used in those. And we have a lot of old wells in Iowa. So it's not, and again, then you have all the same risks once you get inside the home, if depending on your fixtures and your solder and your pipe. So I think we need to do more with well users. It's a trickier consumer segment to get access to, but they are not free from this vulnerability, unfortunately.
And we do have a lot of private wells in Iowa. It's hundreds of thousands of people who are being served by this. So even if it's a small fraction that are being affected, it's still a large number of people. And so if you are concerned about it, then yeah, I would encourage you to get a test done. For folks in Des Moines or the Des Moines area, Des Moines Waterworks does some testing for free as well. Maybe they would like to go to your house if you're concerned and find out if you do have lead. And for some folks who are not eligible under their criteria, I think they charge $18 for tests. So there are ways to get it tested for private wells and for public water supplies as well.
And I think a lot of communities' water systems are now putting up their inventories and making them publicly accessible. So I know the city of Iowa City has done that. So I would encourage folks to look at your water provider and engage with them, like Mike was suggesting, beyond even the testing, like just knowing your risk if you have where you fall, if it's a probable lead service line or unknown. We are at a point where utilities are doing everything they can to make more of that information available to their consumers.
Yeah, and we've also been focusing mostly on what's going on with our water quality inside our homes, but obviously we got kids that go to daycare, they go to school. Mike, you sort of alluded to this before. What's our situation as far as ensuring our drinking water is safe at those public places that our children go to?
Yeah, so for non-transient, non-community water supplies, so that's some place that serves at least 25 people. And it's the same people over and over. So it's not people who are kind of cycling through, like a gas station might serve a bunch of people, but it's not going to be the same people every time. But those schools and places like that serve the same people, and they might be on their own well if they're not in a city. Those are also subject to these requirements, and so they are required to provide an inventory of their potential lead service lines as well. So they also have to take action if their lead levels are above that action level in the rule.
Yeah, go ahead, Dave. Were you going to say something or?
Yeah, there's the lead and copper rule improvements, or the lead and copper rule revisions, which was before the improvements, proposed testing in schools. We've been pretty critical of it, actually, because it just asked for 5 testing locations in schools. And we've tested some schools that have hundreds of outlets, right? And so we you need to look at all of them. So I've got lots of thoughts on sort of we need to be testing in schools and daycares. We need to be thorough about it and not just get a slight, like just a 5 out of 100 won't tell you anything, because the real challenge with lead, particularly in complex buildings, is it could be in one location and you go right next door and it's not there. It just depends on the fixtures. And then we also find kitchens end up being problematic. You've got things like kettles and things that you use to prepare food that use hot water that might be leaded. And so I think it's good that we're finally beginning to look at schools, but we need to do we need to do more to test comprehensively. And then you talk about the funding issue. We've met a lot of schools that don't really are less eager about testing because school budgets are tight. That's a whole other issue. And but it does have an impact here of if you find lead in a school, you can bet parents are going to want that get fixed right away, right? And schools don't have a lot of disposable revenue to just sort of put towards something like that. So anyways, it's something we should all be keeping an eye on and mandating, like, and really advocating for strong action to protect kids in those settings.
So we've mentioned all of these inventories are due next week. And at that moment, we will have an extremely clear picture of our situation. Is that right?
Clearer than we have now. But as
Yes.
Dave said, there is a category that the public water suppliers can put for unknown. So it doesn't mean that we know for sure. There hasn't been a house by house inventory where somebody's actually looking at the pipe to verify. So I know for the Des Moines area, they kind of assume based on the age of the home whether it is a lead service line, and that's probably right most of the time, but it doesn't mean it's right every time.
Yeah, well, just in some reporting I did this week, I mean, Cedar Rapids has identified more than 9,000 lines that they think are going to be subject to this. The vast majority of them, it's, unconfirmed, it's just suspected. Iowa City, this is an exaggeration, but it's like, we know where 2 pipes are, and we think there's, 2,000 more or whatever. So, I mean, where do we go from here? After we get these inventories, we're missing a ton of information. What is going to happen in the next 3 years before, before everything kicks in, kind of?
That's a good question. I mean, I think I'm all for good environmental policy and like trying to push some of these initiatives forward. I worry on a few fronts, like the water utilities that not only have lead, but they have PFAS to be concerned about with a new MCL coming down. And so, man, we are asking a lot of our utilities, particularly in places like Iowa, where we've got a few really large ones, and then we've got a bunch of really small ones, right? Um, I don't know. I'm a little bit dubious. I don't want to sound cynical. Working on these issues in Iowa makes you cynical, though. But 10 years seems tough. We've got these, like, so take those unknown categories. You want to get them out. You got to be confident that they're there. And do you want to spend 10 grand digging it up to find that it's not it, and then and wasted that money without the replacement? We're going to have to figure out how to get more confidence in what we've got. And that's going to be a real challenge, and it's going to slow down replacement. It will slow down replacement. So I hope we stay aggressive with our timeline. I wouldn't be surprised if there's a lot of communities that are struggling to get the pace ready to go. The good news is that everything starts up slow, right? You never start something and have it immediately just kick in. I think there'll be innovation in this space. I think people will figure out ways to replace lead lines better. I think they'll figure out ways to diagnose it better. I think there'll be workforce development in this space. Now, all that stuff takes time, but I'm one of the sneaky benefits of regulations like this is it has to drive innovation. And so maybe the outcome here will be the first few years are going to be a little bit messy, a little bit sloggy, a little bit difficult, but we might be able to pick up some steam, and then a few things will come along, and at the end it'll be good. So let's hope we stick to it, right? We have an election coming, and that's why I know there's a lot of effort to try to get these rules finalized when they are, but there's all sorts of parlor tricks that can be played for rules finalized coming up on an election. That let's hope we aren't back here next year talking about what we need to do about lead service lines.
Yeah, I would anticipate more communities doing some pilot projects, kind of like Des Moines has done, and hopefully, like Dave said, we start slow, but we learn the lessons of what works and figure out ways to do it better. And maybe it's when there's a street being reconstructed, you pair that with lead service line replacement so that it's less disruptive. People are willing to go along with it. They realize I'm not going to be able to drive anyway, and there's going to be construction. Let's just do it now. So there could be some changes to processes that help move things along, but I agree it's going to be slow to get started and hard to see how we replace such a large number, especially in in those communities that don't have the experience or the resources to do it on their own.
And so people need to keep paying attention, and the press needs to keep asking the question of how we're doing, right? Because like 10 years, people, I really worry about losing enthusiasm, losing attention. It just doesn't get resolved the way it needs to get resolved.
Just a reminder to everyone, we are coming down to the final minutes here. We got 5 or 6 minutes left. I want to extend this particular topic just a little bit on identifying pipes. I've been led to believe that, that an easy way without digging is to check the pipe where it comes into a building and figure out what that material is. Is it as simple as doing that? And I know it's not simple because you gotta get, again, homeowner buy-in. But is that a reliable way to figure out what all the rest of these unknowns that we have that we suspect have lead? Or do we need to do what you're trying to figure out, Dave, and have these tests that can tell you, give you hints on what might lie beneath the ground?
Yeah, so there's a long list that the EPA even makes available of like diagnostic techniques to determine where you have a lead service line, and that is one of them. There's also like you've probably heard of Blue Conduit. It's a company that's using sort of machine learning tools and a bunch of parcel level statistics about residences to make a really strong educated guess. I know Des Moines Waterworks, I think, is using Blue Conduit to help with their inventory. And so I think it's going to be some combination of, the best bets to excavate, look at the line and know for sure. You can look at where it's coming into the building. You can use some of those machine learning tools. We're going to be advocating very soon for water quality testing beyond lead and copper, but for a few other metals that will help us be diagnostic. I think it's probably going to be, we like in research, we like to say all the time, converging lines of evidence. I think you're going to want to try multiple approaches and get as confident as you can, and then go for your replacement, right? So that's my suspicion. No one thing is going to be 100% certain unless you actually dig it up and look at it with your own eyes.
Yeah, and city records often cover the city portion, but not the homeowner portion. And so you end up with varying degrees of certainty depending on what records you have. And I know my city sent a postcard asking me to check what kind of line I had and asked me to, take I think it was a penny or a coin to scratch at the line coming into the house, take a picture and send it to them. So cities are, I think, trying to do that outreach, but the people who are going to be responsive, it's not going to be everybody, and it may not be some of the folks who are most at risk.
When we've had instances of tap water that's had high levels of lead, have those always been sort of isolated, contained, one-offs, or have we had in Iowa, obviously not something to the scale of like Flint, Michigan, but have we had like where an area of a town has a significant lead problem?
So the NRDC, the Natural Resources Defense Council, I believe, did a really good report that looked at sort of the nationwide footprint of lead and copper rule violations. And, this is a nationwide problem. Like we hear about these like grave injustices, and Flint was a grave injustice, and we hear about it in Newark or Jackson. There's, these communities that tend to get hit hardest are the Black and brown communities that have all the other environmental justice and environmental racism challenges that have been sort of thrust upon them, right? And so what I would say is we have had the communities with lead and copper rule issues before. I want to say Cedar Rapids is actually a bit of a success story because they had a problem and did what they needed to do by the letter of the law and got back to where they needed to be. And look, that's how it should work, right? It's one of these things where lead and water gets to be really problematic is if it's sustained, ignored, repeatedly, nothing's done to address it. We don't want any violation to ever happen, but they do, and so it's just responding and correcting it, right, and being prompt about it, and most importantly, being open to your consumers and talking to them and rebuilding confidence and trust, and that's a huge toll on water providers, right, because they're not built to be like a public engagement they need to be, but like there's only so much that we resource our utilities and water providers to be able to do. So I don't think we should think of that we don't have this issue in Iowa. We will. It won't be everywhere. It's like everything else. I think we should be cautious to reduce Iowa down to this is a problem everywhere to this, or this is a problem nowhere. It's never that simple. It's going to be a problem in select places, and so the only way you know is if you put in the work to figure out who's most vulnerable.
And I think we learned from Flint and kind of like we talked about today, the safe water that we were drinking is based on ongoing practices. And so if those practices change, if corrosion control stops at a water utility, then the risk goes up. And so as long as we keep doing what we need to be doing, the risks can be low. But it's not like it's guaranteed forever.
Yeah, and I know we're about out of time, but like that's a great point that Mike's making is like two big things that we have to worry about in the water sector that can lead to these types of events. One is more privatization of water supplies. Like we often see cost-cutting measures. That's happened in a few places like Pittsburgh, where a company came in and bought out the local utility and did some cost cutting, changed their chemicals and started having lead issues. The other is I talk about Flint in my climate change talks. Like what triggered the problems in Flint was a change in source water. And we know we're going to have communities that is dry up or become less reliable are going to change source waters. And if you're not smart about changing your source water and thinking about how that's going to impact your corrosion, the corrosion of your distribution system, or if you're going to put in a reverse osmosis to remove nitrate and you aren't thinking about, what's going to happen to the lead in your pipes, like you could have a problem. So Mike's exactly right. Like there'll be changes that we know will come in water providing from water providers. And that's when there's vulnerabilities that we got to make sure people are thinking like holistically about their distribution system when those changes happen.
Thank you guys for joining us today. It's always a pleasure. Thanks to the audience. We are out of time, except one final question. Mike, I can tell what your answer is going to be based on what you're wearing, but who are you guys rooting for this weekend?
I'm a hot guy.
Okay.
I was gonna say, what's even the game I should know? Who's playing?
You're the one wearing the Hawkeye shirt, man.
Well, I go to they pay the bills, man. I gotta. I mean, we always root for the Hawks. I mean, come on. I got a son who was born in Iowa, where I'm not from Iowa originally, and he loves the Hawks. So go Hawks.
Should be the Huskies should be a bit easier than last week's game. So
yeah.
All right. Thanks, guys.
Thanks, everyone.
Thank you.